Welcome back to my channel. As you know, the last few weeks we've been talking about Botox and Dysport treatments, and I want to end our Botox and Dysport series with some facts and myths about Botox and Dysport. My name's Rebecca Kelly. I'm a board-certified nurse practitioner. I'm the owner of AIYANA Aesthetics. We are a Medi-Spa and Wellness Center, and I'm so glad that you're here with me. So let's talk a little bit about some facts and myths about Botox and Dysport. As you know, as you've been listening to the previous videos, the biggest fact about Botox and Dysport is that it truly is a wrinkle relaxer. It's going to relax your wrinkles and just soften out your skin. A lot of people will consider it like a Botox glow, and that's just because everything's smoothed out. You're able to apply your skincare and your makeup flawlessly so that you don't have any of your makeup kind of sticking in those creases on your face. So it is true, it really does give you a glowing effect, and that's just because everything is smoothed out on your face. So one myth that I get all the time is that Botox or Dysport is going to make you look puffy. And a lot of times people get a little confused with the difference between Botox and filler. So there's a huge difference between the two. Botox is a wrinkle relaxer. Filler adds volume and defines. So they're completely different. Botox is a neurotoxin. That's the medication that it is. Where filler is a hyaluronic acid. So hyaluronic acid, when it's injected in your face, it draws in water and can add a little bit of volume and add some definition. Botox never does that. All Botox does is it is injected into your muscles and it relaxes those muscles. It tells them to stop contracting. So Botox cannot make you look puffy. So that's one myth. So another fact about Botox and Dysport is that it does last about 3 to 4 months. So a lot of people think, okay, it's going to be perfect for the whole 3 to 4 months. This is a myth. That is not the case. Its perfect timing is between 2 weeks and 2 months after injections. After the 2-month mark, it'll start to decline. So that's where people get a little bit confused because they get to the 2-month mark and they're like, oh my gosh, I need to come back in. My wrinkles are coming back. But the reality is that you cannot come in any sooner than 3 months because if you inject it too soon, you can actually build antibodies. So that is where, you really have to be in tune with your injector and have them help you get scheduled. We schedule all of our patients before they leave so that we can ensure that you're on the right track and that you're timing your Botox and Dysport right so that you're not building those antibodies. Another thing that a lot of people think is that Botox is addictive. I don't know how to answer that question because honestly, once you get it, you're going to realize, oh my gosh, I love how this makes my skin look. It looks so smooth. Maybe it's helping with my headaches or maybe it's helping with my TMJ and I had no idea that it could help that much. So yes, a lot of my patients are getting it done consistently every 3 to 4 months because they love how it makes their skin look. It is not something though that you have to stick with. You can certainly do it for a certain amount of time and you can come off of it. That's another myth. People think once they come off of it, they're just gonna look old and haggard and horrible again. But the truth is we've relaxed those muscles for so long that your wrinkles will just go back to where they were before. They're not gonna be any worse than where they were before because we haven't allowed you to make those contractions. So I love to share some of my patient experiences with you because I think that I've seen a lot of patients. This is kind of our clinic niche, is that we've seen a lot of patients who've never had this done before. And I love that because they come to us, they feel like we're a safe space, which is our goal, is to invite everybody in. There are no stupid questions. And they feel like they can ask these questions and get an honest answer. And so I love being able to share some of my patient stories with you because I think that it really illustrates how impactful Botox and Dysport can be. So I had one patient come in, she had never had the treatment before and she was so nervous. She doesn't like injections, which I thought was really cute because I'm like, well, that's what we're going to be doing today. But we talked to her about it. I answered all of her questions and she's like, okay, I can do this. And the first time she got her Botox and Dysport treatment, she texted us at the 2-week mark and she's like, I cannot believe what a difference this has made. I feel so confident in my skin. I hardly have to wear any makeup because I don't feel like I have to hide all those lines and wrinkles. And I love that story because it truly can boost your confidence and really empower you to feel confident just in your skin. So Botox and Dysport is an amazing treatment. I always encourage my patients, just give it a try. I like to always start low and then we can go from there. And really, if you just kind of dabble in it and kind of see what you think and what you like, and we can work with you to come up with the best plan. All right, thank you so much for joining me. I appreciate you being here. Be sure to like and comment below. You can subscribe as well, and then ensure that you share this with your friends and family, and we will see you next time.